So this is Parascaris. Oh, sorry. This video is for the horses. Only the horses. It'll be kind of long because there's quite a few. But this is Parascaris, which is the equine roundworm. Sorry that I don't have any adults in these videos. When I made my Quizlets, I didn't include the adults because in my previous class, we didn't really have to know that kind of stuff. But it's going to look like a roundworm in general. It's just the horse kind. So definitive host is just going to be your equids. This is a direct life cycle, but I do have details about it here. The eggs look like a typical roundworm. The only thing to note is that they can be corrugated. So it's just important to note, like, if you see a roundworm on our lab exam, we really have to look at what species it is from because this is a very specific equine one. So if you see a roundworm, she says she collected it from a horse, it's going to be Parascaris. So life cycle, the egg is ingested. The larvae are released in the small intestines. They migrate to the liver. They do the hepatopulmonary tracheal pathway that then leads to a cough swallow. The adults will develop into the small intestines, and then the eggs will pass in the feces. This usually affects mainly foals and yearlings because they haven't developed immunity. Immunity is typically at 4 to 6 months. The liver, as part of that migration of the larvae, will have hemorrhage and milk spots. The lungs will have pinpoint hemorrhage and some edema and then enteritis from the adults in the small intestines. Symptoms include cough, nasal discharge, fever, colic, and appetence, lethargy, diarrhea, and then from the actual worm itself, because roundworms can be kind of big, and if there's multiple, it can cause intestinal obstruction and perforation, which that's going to be important with treatment. So I'll get to that in a second. Infective stage is eggs with L3. Diagnosis stage is just the egg right there. Diagnosis for the foals, they're not old enough for eggs to be passed into the feces. So clinical signs for your adults, this is just a qualitative fecal float. It's not a quantitative. You only do that with like your strongyles and those kind of things. Treatment, this is where it's important. Your benzimidazoles are going to be best because they kill them slowly. You can technically do your NAs and your MLs, but these are really fast acting. And if you push all of those adult roundworms out too fast, it can cause more intestinal obstruction and perforation. Also, Parascaris has widespread resistance to macrocyclic lactones. So yes, it technically can work if they're not resistant, but it just wouldn't be a good option in general. Control, remove the feces, reduce the stocking rate, and you can actually compost the feces to kill the eggs, and it is not zoonotic. So this is Strongylus vulgaris. It is one of the 3 large strongyles. Its definitive host is, of course, an equines or equids. A lot of the information on this is probably going to repeat between the different large strongyles, but I did most of it under this one, and then there would just be slight differences between them. So the adults of all large strongyles, they're going to be found in the colon and the cecum, and then the worm themselves, the adult worm, is going to have a very well-defined buccal cavity. Teeth will be found at the base and a leaf crown. Now, the way to tell the difference between the 3 different large strongyles is based off of how many teeth they have. So vulgaris has 2 teeth. How I remember that is V has 2 lines. I don't know if that helps. V has 2 lines, so 2 teeth. All the eggs are going to look like strongyle type eggs. Between both the large and the small, it's going to look like this. Just have a morula. Okay. So the life cycle specifically of Strongylus vulgaris is going to be the eggs and the feces. The L3 is what's infective, and that's ingested, goes to the small intestine mucosa. From there, the L4s enter the intestinal arteries. Then the L4s migrate to the cranial mesenteric artery and becomes an L5 there. It'll sit there for a little bit and grow and mature and do some damage. Then it'll escape to the intestines to become an adult, and then the adults will lay their eggs. So this is the only nematode in horses that will enter the arterial system, the cranial mesenteric artery. So there it can form a thromboembolic colic. It causes verminous arteritis, infarction, so death of the tissue and even possibly an aneurysm. S. vulgaris is found more commonly in older horses, but it'll be more severe in younger horses. The symptoms: sudden fever, lethargy, colic, anorexia, diarrhea, constipation, and especially anemia. Like I said, the infective stage is going to be L3. Diagnosis stage is an egg, but of course, all horses have some kind of strongyle eggs. So you also kind of have to go off of symptoms. So the diagnosis. With all of our strongyles, we will do a quantitative fecal float, but that fecal egg count does not correlate with how heavy that worm burden is. But the reason you do this is you can see which horses will spread the most infection because they're putting the most eggs into the environment. And so let's say that you're having this as a problem on your farm, you want to find the ones that have a high fecal egg count, even though they may not be showing symptoms. You want to treat these because then they won't be spreading as many eggs out into the environment. So there's also differences that you can tell based off of how old the horse is, based off of this quantitative fecal float. So if the horse or the foal is less than 6 weeks, most likely they aren't actually infected. They ate an egg from the mare and the egg is just passing through. So that's coprophagy. 6 weeks to 6 months, that isn't enough time for a large strongyle to actually cause issues. So that's most likely from a small strongyle. If they are greater than 6 months, it could be either. So specifically with S. vulgaris, you will always treat it if you find it. And you can do any of the big 3 because there is no resistance in the large strongyles. And this is not zoonotic. This is Strongylus equinus, which is also another large strongyle. So the only differences that I had, equinus has 3 teeth. So no, it's stupid, but this is how I remember it. Remember, vulgaris has 2 lines, so that's how you remember 2. Equinus has, when you write an E, you do like your 1 line, but then you go 1, 2, 3. You're 1, 2, 3. That's how I remember it has 3 teeth. It's stupid, but it works for me. Everything else is the same. The life cycle, they ingest the L3, it penetrates the intestine, becomes an L4, migrates to the liver and the peritoneal cavity and the pancreas. Then it'll become an adult, go to the cecum, and then eggs in the feces. Symptoms, you won't really see symptoms unless it's a heavy worm burden. So colic, liver hemorrhage, anorexia, lethargy. And then all of the infective stage is the same. L3 diagnosis stage is an egg. Again, fecal float, but the FCC doesn't really count. It'll only be a large strongyle if it is greater than 6 months. So this one, different from vulgaris, you only do selective deworming because you can also have small strongyles, and small strongyles have developed resistance. So you only want to actually deworm against equinus if they have a heavy worm burden that's causing symptoms. Okay, this is the last large strongyle, the Strongylus edentus. Again, most of it's the same. So the biggest difference here is this one actually has no teeth. So how I remember it is you went to the dentist, edentus, and they took all your teeth. So edentus has no teeth. Okay. The life cycle for this one is you ingest the L3, it punctures, so it goes all the way through the intestinal system, and it'll puncture the cecum, migrate to the liver, go through the subperitoneal tissue via the hepatic ligament portal system, so it goes through the portal vein, returns to the cecum, so it escapes and it wanders, comes back, develops into an adult, and lays an egg. So as it's migrating, it causes damage to the liver, the peritoneum, and then the gut wall, so it can cause peritonitis. It'll have fluctuating fever, anorexia, lethargy, colic, diarrhea, and constipation, and anemia. Again, you won't see this one unless the horse is greater than 6 months, and you still do selective deworming with this. This is our cyanthostomes, which is also our small strongyles. The definitive host will also be equids. It's a direct life cycle. They're also found in the colon and cecum. They will have strongyle type eggs. Again, you ingest, or not us, the horse ingests L3, migrates to the cecum and the colon, and will encyst there, develop into an L4. Then it'll excyst and become L5 in an adult, mate, and then lay eggs. Now, if there is adverse conditions, they can hyperbiose. And when the larva reemerges after it is hyperbiosed, it causes larval xanthostominosis. This requires at least 1 season on pasture. There are 2 different symptoms based off of, like, this is only the worm. This is with larval xanthostominosis. So just the worm, you have poor hair, weight loss, loose stool, pot belly, just general wormy kind of symptoms. For this one, you'll have chronic diarrhea, hyperproteinemia, edema, and weight loss. Again, just like our large strongyles, infective stage is L3, diagnostic stage is the egg. Now here, If it's 6 weeks to 6 months, it's probably a small strongyle. So in that middle age, but then greater than 6 months, it can be either large or small. This has the same rules that you do a quantitative, but the FVC does not correlate with the worm burden. However, if they're showing symptoms of larval cyanthostominosis, there's no eggs yet because it's the larva just emerging from the small intestine. So you really don't do routine deworming, because once you routinely deworm and you kill all the adults, then the environment's empty and ready for larval cyanthostominosis to occur. So you can induce that to happen. When you treat these, you just typically are trying to avoid clinical signs that reduce eggs on pastures. You do it selectively because there is widespread resistance to both pyrantel and our benzimidazole. So the best, technically, like the one that won't be resistant is macrocyclic lactones, but you don't want to accidentally help develop macrocyclic lactone resistance. So technically all big three, but there is widespread resistance in the small strongyles to pyrantel and benzimidazole. So for control, the type of number of treatments that you do with these horses is based off of their fecal egg counts. So less than 200, you do 2, 200 to 500, you do 3, 500, you do 4. And you always do an annual FECRT so that you can analyze these kind of things. And of course, it's not zoonotic. So this is equine pinworm, which its scientific name is Oxyurus equi. It's important to note that there is no pinworm at all in dog, cats, or cattle. So if you see a pinworm, it's going to be horse, okay? Definitive host is equids. It's a direct life cycle. So this is a terrible image because it's really hard for me to draw clear, but they are very easily to see. They're going to be very thin, very clear. Something else to note, though, that I learned in my human parasitology class is you can honestly tell that it's a pinworm because when you do a Scotch tape test, there isn't a lot of junk that's just floating around because you're just sticking tape to the anus and pull it off, so there won't be like fecal material or grass or whatever. So if you see a very clear slide with these kind of shells on it, it's going to be pinworm. So anywho, direct life cycle, you ingest the larvated egg, it goes small intestine, cecum columns to large intestine. L4 and L5, the adults will then lay eggs in what's called cementing fluid. It'll cause pruritus ani, and so symptoms, rat tail, they're rubbing against things, trying to itch themselves, that kind of thing. Infective stage is going to be the egg with the L3, so it takes a little bit for it to develop. Diagnostic stage is going to be this egg. Like I said, Scotch tape test. Treatment, you can do the big three. There is some resistance shown to ivermectin. To control it, you can clean with disposable rags, and these are very hardy eggs, so you just have to make sure that you're not the one that's spreading it, so stable hygiene. This is Anoplocephala, which is the equine tapeworm. There are 3 different species, and the only difference between them is where they go in the body. So definitive host is going to be your equids. For all of them, though, the intermediate host is your pasture or baited mites, so pasture mites. And so your adults, if it's perfoliata, just remember perforation. So it's going to be at a spot where it tends to like damage the cecum, so perforate the cecum, so it's going to be at the ileocecal junction. Magna and mammillana is going to be your small intestine. I don't know how important that is, but it was in there. So, but the eggs, they're kind of like crystally looking, but they're going to be D-shaped. That's like your embryo, and then there's a thing called a piriform apparatus inside of it. Your life cycle, the horse ingests the mite with the cysticercoid in it. It goes to the adults. It just forms gravid proglottids, eggs into the mites, so pretty easy. Your perfoliata will block the valves at the ileocecal junction and cause cecal death, but all the species will just cause GI issues. The infective stage is that cysticercoid in the mite. Diagnostic stage will be that egg. To do a fecal float, though, you need a lot of feces, and you have to centrifuge it, and you got to use sugar. Treatment is going to be praziquantel. And to control it, you have to try to control the mites, which will be hard, and then pasture management, which is also hard. So this is Dictyocollis arnfeldi, which is the equine lungworm. So this one's special compared to the other ones that we've done because the definitive host is usually actually not horses. It is donkeys and your non-horse equids. I say that they're not applicable for eggs because the diagnostic stage is going to be a larva, L1. It just causes coughing and respiratory distress. Our infective stage is L3. You do a Behrman to diagnose that L1. Treatment is extralabel, ivermectin, or fenbendazole. This is Strongyloides westeri, which is the equine lungworm. There's not much we need to know about it, which is good. I forgot to write it, but of course the definitive host is equines. The egg is going to be larvated, so there will be a little worm in there. Most of the time, and the reason why we don't need to know about it is it's mostly symptomatic. If you have a young foal, they might have diarrhea. The infective stage is going to be either the larvated egg there, or it can actually pass through the milk, so lactogenic, L3. Diagnostic stage is going to be that egg. Diagnosis, fecal float for that egg, and then treatment is just ivermectin. Okay, this is the last worm. Yay! So this is Habernemus / Drachia, which has multiple names. It is the stomach worm, summer sore, swamp cancer, granular dermatitis. Okay, definitive host is your equids. There is an intermediate host of flies, so this is the only one with flies for our horses. I didn't draw the egg, but it would have a larva inside of it. You can go look at Andrew's Quizlet for that. So how the life cycle, you ingest the fly, or the L3 can penetrate through the skin, which is the cutaneous form. The adults will go into the stomach, pass eggs with the L1 into the feces. The fly will eat it, develop into an L3 in the fly. Pathology. So if it's the gastric form, it'll penetrate the stomach and form large fibrous tumors. That's why it's called swamp cancer. Cutaneous, it'll develop sores and rapid granulation, which is why it's called granular dermatitis. So again, that infective stage is your L3. Your diagnostic stage is either going to be the larvated egg or the L1. If it's gastric, it's kind of stuck in the stomach, so it's going to be hard to diagnose. If you can find an adult, you can ID the adult. Cutaneous, you look at the lesions, you do a biopsy and see what's there. If it's the gastric form, you can do macrocyclic lactones for the adults, but the tumors are going to be hard to treat. Cutaneous will be ivermectin. You can surgically remove the granulated tissue, and you can do steroids for inflammation. And for control, you kind of have to control the flies, and it is not zoonotic. So that is the last one for for equines, and that is the last one that I'm going to film. So yay!